Good afternoon, ladies and gentlemen. My name is Julie Paton, and I'm a pharmacy technician based at Wrexham Myler Hospital. In November 2014, the Pharmacy Service Improvement Team was created, and this was to support the Associate Chief of Staff. I was lucky enough to be chosen to be part of this team and given a specific area to look after, and that was medicines waste. I knew this task would be enormous. There is in excess of £50 million worth of medicines waste per year in Wales alone. We felt, as the majority of my knowledge is in secondary care, that this is where I would begin. Using service improvement methodology, I began studying the current recycling situation at Wrexham Myler Hospital. And starting with an audit, I found that one large sack per day was full of returned medication. I soon established that the medication waste came from all over the hospital and from smaller linked community hospitals directly to the dispensary within the pharmacy. Now, a certain amount of medicines waste is inevitable, such as that is not fit for purpose, and a professional code of ethics states that we cannot reuse medicines that has left the premises, that is the patient's own, if it's expired, part used, creams, lotions, eye drops or inhalers, and anything that we have any doubt over its efficacy, such as compliance with the cold chain. This is the waste from one sack, and we have one sack per day. A second audit was completed, and this was to establish the financial cost of the remaining reusable contents of each sack, and to distinguish between a full and complete box or a box that had been partially used. The data was analysed from the 3 sacks, and the average value of full boxes is £1,862, but the value of reusable stock of part boxes was £434. It revealed that approximately 25% of the returned medication had only 1 or 2 tablets missing per box. I started by setting up a team of waste gurus from across the 3 sites within the trust. The people involved were chosen because they all wanted change and they felt passionate about the excessive amount of waste that we have. Together we brainstormed and we came up with a plan. We knew that the process must be sustainable and quantifiable, and it meant that we could not make the dispensing process any longer. And any returning of the medication must be measured in financial cost. The identification of these potential significant savings from using the part packs of medication prompted discussions with senior managers. It was always thought that due to the time-consuming laborious task of recycling these part boxes back into our system, that this was outweighed by the cost of the staff member completing the work. It was now my time to prove that this was worth doing and how we were going to do it. Starting in the Wrexham Myler Hospital, senior staff agreed to trial the reuse of these part packs for 1 month. This involved a significant amount of work. IT was required to set up a tracker system so that we can continually calculate the savings that are made. One for full boxes and a separate one for the part boxes. This has enabled us to know exactly how much financially we were returning into stock each month. Staff were informed of the new changes, and this included presentations and team meetings. I started with a higher or lower game on the cost of medication, and it soon became clear that our knowledge was poor and we were pharmacy staff. Therefore, staff were educated on the cost of the drugs, and IT amended the computer screen view so that it could show the cost of each individual price of each drug as we were dispensing it. I also started with standing operating procedures, wrote a new one, and educated the staff that there's a star on the label of the actual drug, and that star annotates that it is a low-cost drug. This is a picture of our waste recycling room. The last picture, this was our dispensary. So the shelves that you can see are where we stock the part boxes, and they go in alphabetical order. And we have got another shelf on the other side. So this is our waste room, or we call it the dupe room. On occasions it looks a lot messier and a lot busier than that picture shows. But what we do know is that if we do get a build-up of medication, that at some point we will go in that room and we will recycle those medications, and we will make sure that they are used and that we have zero waste. It did soon become apparent that we did not have sufficient space to store all the part boxes, and as the audit identified, 25% of the packs only had 1 or 2 tablet missing per 28. For a trial period, red dot boxes were introduced. So this enables us to return this box back into the automated system. So the red dot on the person's signature who's returning that drug is inside the red dot. They are used and labelled exactly like a full box would be. The exception is only outpatients or antibiotics or steroids and a few others. It is really important that when we are returning these back into the automated system, that accuracy is essential, but to date we haven't had a single problem. Momentum. I also found it was important for me to keep encouraging staff to participate in the recycling of the part packs. So I did this by introducing a recycling hour between 9 and 10 in the morning, and this is where we would only ever use part packs first. But actually, this has evolved, and now we use part packs first every time, and we call it doing our shopping first. So with the support of senior management team, we have implemented further changes to assist in the sustainability of this project, such as we include recycling now on the work rota, and there has been an introduction of automated ordering processes directly from the pharmacists and the medsman techs who are out on the ward. The automated order is annotated whether they want a full pack, a split pack or a small supply. So when it comes through to the dispensary, we know exactly what we're going to give. So after the initial test phase and various alterations to the process, I knew I had a robust system. Therefore, together with the appointed waste gurus, I began discussions with implementation with senior staff in Ysbyty Glan-Clwyd and Ysbyty Gwynedd, the other 2 sites that are within Betsi Cadwaladr. After some initial concerns and changing of a few mindset, Ysbyty Glan-Clwyd have proven to be just as motivated and successful as Wrexham Hospital. Ysbyty Gwynedd were a little bit slower to get on board, but they are now adapting and have implemented this process. This project requires passionate staff and supportive managers, as they must continually drive the project forward. I am extremely fortunate in Wrexham Myler Hospital because the staff are so passionate about recycling, and it's become the norm to use part packs. The staff eagerly await our recycling figures each month. And therefore, I've now set up these block graphs. They're large and they're within the dispensary, and it just shows how much recycling we are completing year to date. Sometimes, due to staff shortages, there's been a build-up of medicines waste, and that dupe room was full, overflowing. But the staff are so passionate, they've even volunteered to come in on a weekend to get rid of the backlog. We feel in our department that we must have zero waste. We don't want to waste a single penny of taxpayers' money. Results. I've continuously been monitoring the financial amount of recycling in part boxes and red dot boxes, and to date it has saved £236,397, and it is projected to save £80,000 annually, and this is in one site, Wrexham Myler. The graph above shows data from the time the project began until now at the Wrexham Myler Hospital. As already mentioned, recycling the full packs or the part packs is a very time-consuming, laborious job. But due to this financial cost savings, we are currently in the process of researching the possibility of receiving an additional staff member by the Invest to Save initiative, and this would secure the future of the project. The graph above shows the total cost of savings made from the recycling of medication across the trust. We've always historically reused full boxes, but this was just a way of measuring exactly how much cost we're saving by the full boxes. But now this project was about how much cost savings can we save from using part packs. The conclusion. This process is not only quantifiable, but it is sustainable. The total savings for part packs across the 3 sites in Betsi Cadwaladr University Health Board from the time that this project began until date is £445,581. The recycling of part packs is definitely not a waste of time.